So first visit, usually we book for about an hour and a half in my office because you have to review all of the paperwork, health history forms that the patient has filled out, any medical situations. There's a lot of questions that may need answered for that, as well as any x-rays, previous films that a patient has had from their previous dentist. So that's the start. That usually, a lot of that, the paperwork will be sent to the patient, or the patient can fill it out online. So that saves a little bit of time. But typically, in the first visit, we look at obviously a comprehensive exam. If the patient doesn't have any recent current radiographs, we take those. Their teeth are periodontal periodontal charted, so we do a periodontal or gum evaluation. We do a restorative, a cavity evaluation. We do an oral cancer examination, which is extremely important today. The oral cancer is the 6th most common form of cancer. And so as dentists, we oftentimes would be the front line in early detection and obviously prevention of oral cancer. So that's an extremely important part of our exam, to meet patients. With that, patients will have their teeth cleaned, and then I actually come in and I do a whole exam as well. So I think it's important that the patient understands that now it may be a longer appointment is a necessary appointment, but I think that's at that time where it's important for me as a treating dentist, as well as the rest of my staff, is to listen to the patient. Many patients come in and have some preconceived notions, or they have had good or bad experiences previously. And so we don't want that to color what we're going to do in our office. So I think it's important that, I sit down and I listen to the patient, ask them what their concerns are, because you get a whole lot of information, a lot of history with the patient in order for me to understand, number one, is this an anxious patient? Is this a patient that needs a lot more information, very detailed explanations of things that we're going to do? And that will shape how I look at the patient, how I formulate a treatment plan, how I interact with the patient, as well as how my staff interact with the patient. So that's critical. Listening to a patient, you can glean a lot of information, and that's a necessary part. It's their mouth, it's their issues that need to be solved. And so I am the person who actually can help them with that, but patients own their own problems. And so it's up to me to really at length describe what needs to be done, what the situation is, and what needs to be done to restore their mouth to run the healthy function. First appointment, actually, what we like to do is any information that the patient has had from a previous treating dentist, x-rays, obviously history, something maybe more extensive work that we need more information about that, patient records. Those are the things that we would like to have extra ahead of time. If that's not possible to obtain those ahead of time, then absolutely the patient needs to bring copies of that. Otherwise, the visit really is not going to be as productive as we want because we don't have all of the information. There's the information, the x-ray information, there's the clinical information, there's the patient information by questioning the patient, listening to their concerns, and integrating and collating all of that information in order to really figure out what's going on with the patient and what needs to be done for the treatment. I think patients worry too much about a first visit. I guess it's the unknown, but eat. If you're diabetic, obviously you have to eat. I don't need a blood sugar on a patient dropping and having them on the floor and calling the EMS. So smart things like that. Obviously, eat before you come. It would be nice if you were cleaning your teeth before, but we have a test that we can see how well you brushed before you came. It's to the patient's advantage, obviously, to make sure that obviously they do the best we can, because that's also part of the evaluation. If patients aren't as versed in cleaning their teeth, whether it's brushing or flossing or whatever, then we can look at that and we can help the patient and teach them other ways or give them other devices that will help them do a better job. Typically, standard, usually book patients about every 6 months for the routine checkups. With that being said, there are some that require more, and some people are on a 3-month schedule, some people are on a 4-month schedule. Individuals who have had periodontal surgery, more extensive gum cleaning, I guess you would say, those individuals are obviously on a more frequent basis just to keep things under control and to monitor their periodontal health in case there may be relapses in that, so that we can actually anticipate that and actually treat it before it gets out of hand. Children typically about every 6 months. So that's probably the standard. Sometimes, obviously, it may be more than that because things change. People's lives are very busy. So some people may have to change those appointments, or sometimes it could be 7 months, but typically we stick to the 6 month. Those appointments are actually scheduled before patient leaves for their next routine checkup and cleaning. So patient will leave with that. They will get a reminder by email and text, about their appointments, so that they don't forget, because obviously we're booking 6 months ahead and the schedules change. But typically that 6 month schedule is the usually key. Patient knows if they haven't been. I just had somebody who hadn't been to the dentist in 15 years. And so, he was beating himself up sitting there speaking with me. I said, look, I'm not going to say anything about that. It's because you've already laid the guilt trip on yourself. I said, that it's too long. The important thing is that we're here now. So we can't judge by the past. We can only go forward. And I think that's the important thing that patients have to understand. I'm not a punitive kind of person. I'm glad that they're here. All right. And they've recognized, whether it's, someone untwisting them or just realizing, like, this is stupid. I really need to have my teeth checked because I'm having a problem. And a lot of times that's the impetus for people showing up. But other times it's just they forget. And the longer it goes, the easier it is to not do it. But I think that, when patients come in, I'm happy to see them. As I said, we don't reflect on what's gone before. The fact that they're here and that being here for, that's important to their dental health. I mean, it's very upsetting when I hear stories about people like dentists had, his knee on my chest and, taking a tooth out and all this craziness. I mean, obviously I've never experienced that, nor did my father before me, who was a dentist. I think the important thing with there are people who have anxiety, period. And there are ways we can deal with that, establish patience. And there are medications that we can use prior to, to first coming in to just to take the edge off that anxiety. I think the important thing with anxiety is that a lot of times people have not been explained to people. And so they're making all of these things, in their head or on social media or TikTok or whatever. And so, which is the worst place, as well as Google, Dr. Google, I call it, to really look for information, because that gives you general information. It's not specific to that patient. And so I would say that if there are issues, you have anxiety issues or concerns, then we talk about it. I mean, there's nothing wrong with coming in and having a discussion with the patient. To me, and they'll say, well, I'm wasting your time. I said, it's not a waste of time, because it's all about you. And whatever we can do to make you feel comfortable, to understand your treatments, and that you're comfortable with that, and all of your questions are answered, that's my job. In the dental treatment, as I said, developing a treatment classification was critical, because otherwise, it's tooth by tooth, which is not the way to treat patients. It's comprehensive care. There's 2 phases to that. There's the basic phase 1, which includes your cleaning, your x-rays, basic restorative, cavity filling, things like that. And the second phase of treatment can be more comprehensive. That can include things such as bridge work, implants, crowning teeth, periodontal treatments with the patient, oral surgery, a whole host of things. But I think the important thing is that the patient's mouth has to be at least up to the first phase of all of the basic work, like the cavities, etc., are done, so the patient is at the holding pattern. My job is to tell the patient and let the patient know some of the other concerns and address those. Today, with digital radiography and the ability to blow up an x-ray, on the whole screen, so patients can really see what the problems are, what their problems are, and what and so they get an overall picture. So it's very easy to talk to the patients and about their situations. And so, ultimately, as patients have to understand that it's their problem, oftentimes too, things that can be staged. There may be a lot of things that need to be done, but they can be staged, typically. There are some things that may very well have to be taken care of immediately. You have an infected tooth, you actually don't want to be walking around with that. That's like something critical that needs to be taken care of. But other things like a large restoration or a tooth that's been broken and has a very large restoration needs a crown. I mean, a patient can potentially wait on that while addressing some of their other needs. You also try and work with a patient with their dental benefit, so that they can get the maximum they're out of that. And so helping that patient do that makes things a lot more affordable too. And so unless there's something that's really, really pressing, most things can be dealt with. And so the patient, actually involving the patient in their treatment and what their priorities are, and so that we can, we can tailor the treatment plan and their work, to that. So if you have any questions about this video, please enter them below. We'd be happy to answer them for you.